Hi everyone, my name is Dr. DeFabio. I'm here at Ravenswood Chiropractic and Wellness Center in Chicago. Just want to take a few minutes to talk about TMJ, or temporomandibular joint pain, and one of the symptoms that we could see with it, that's ringing in the ears, also known as tinnitus. Now, not every patient that comes in will have ringing in the ears or tinnitus if they're having TMD, or temporomandibular joint dysfunction. That's just a fancy way of saying there's something going wrong with your TMJ. But it is something we want to consider. Now, before we get into what causes it, we need to further appreciate what's going on at the joint normally. Now, the TMJ, there was a really cool study that came out in 22 that broke down the neurological innervation at the temporomandibular joint. And researchers had found that the auriculotemporal nerve, the mesenteric nerve, the deep temporal nerve, and the mandibular nerve all innervate the TMJ. Not only that, but there's varying levels of innervation based off of one person versus another. So having a comprehensive neurological evaluation of the upper cervical spine and around the TMJ joint is hugely important if you want to see if the ringing that you're experiencing may be due to the TMJ pain that you're feeling as well. So that's really important. Once you've ruled that out, you also need to consider, is there any sort of internal ear pathology, something going on in the middle or inner ear that could be causing the ringing that you're experiencing. So once you've kind of classified yourself into what camp as to what's causing the ringing, is this a jaw issue or is this an ear issue, then we can further figure out what's going to be the best treatment for you. If in fact this is more of a somatovisceral referral pattern due to a TMD condition, there are different techniques through conservative management that we can do to address that, whether it's any sort of myofascial techniques or joint manipulation and mobilization to reestablish better TMJ joint mechanics. Those are all different conservative treatment options that we have. So chiropractic adjustments, physical therapy, stretches and exercises, or other advanced passive modalities to accelerate the healing process. But it really just starts with an assessment from a chiropractic physician or other licensed healthcare practitioner that has a lot of experience with evaluating TMJ.